Today we're going to perform an assessment of your abdomen. You should stand at the right side of the patient. Using auscultation, percussion, inspection, and palpation, inspect the patient's abdomen for any abnormalities. To start, you should have the patient empty their bladder, be in a well-lit room with the patient lying supine, hands at their sides, and a pillow elevating the head and the knees. Now I need you to relax, so if you could use some visual imagery and breathing techniques to try to relax yourself, we'll begin. First, I'm going to do a visual inspection. I'm going to divide the abdomen into 4 quadrants so I can imagine where the organs will be lying underneath. If I divide the abdomen into 4 quadrants, in the right upper quadrant will be the liver, pancreas, gallbladder, and part of the colon. And in the upper left quadrant will be the left lobe of the liver, the transverse and descending colons, the stomach, and the body of the pancreas. In the lower lobes, the lower quadrants of the abdomen are mostly the colon. Also, we divide the abdomen into 3 regions: the umbilicus, the epigastric, and the suprapubic region. So with that in mind, it should be noted that the abdomen should be smooth and symmetrical. Note any bulges or masses. Also, inspect the umbilicus. Ask the patient to lift their shoulders and head and hold it. Okay, it's nice and smooth. There's no bulges that would indicate a hernia. Okay, you can lay back down. Now, there's no surgical wounds or stretch marks, any striations on the patient's abdomen. Color is uniform and the skin is smooth. Next, I'm going to use auscultation. Starting in the right lower quadrant, I'm going to auscultate the patient's abdomen and listen to bowel sounds. Okay. I'm going to listen to your bowel sounds. It might be a little cold at first, okay? Moving clockwise. Bowel sounds should be hypo, hyper, or normal active. Then I'm going to listen for vascular sounds. The aortic, the renal, the iliac, and the femoral arteries. No bruits, friction rub, or hums were noted. Then I'm going to start some percussion. Percussion is used to identify where the organs are in the body and the size of the organs. So I'm going to check for the liver and the spleen, and I'm going to use some techniques to try to identify where the organs are located and the size. For the liver, you start in the lower quadrant on the right, and you percuss from tympani, which is where the colon is, to dullness. add it to my pen. So we mark the area for tympani. Okay. I'm sorry, mark the area for dullness. Then you start, also you should go mid-clavicular line and then go up. So again, so dullness starts around here. Then you start down, then you go downward, and you start from the area of dullness. To tympani, and which is around here. So then the span of the liver should not be more than 2.5 to 4 3/4. It should be 2.5 to 4 3/4 inches long, and that's the normal size of a liver. So anything larger than that would indicate that the liver is swollen. Anything smaller would indicate that it's either displaced by the diaphragm, which would indicate pulmonary problems, or atrophy, which is the dying of the muscle. Then I'm going to percuss for the spleen. The spleen is lateral on the left side, and it's usually in the bottom of, it's located at the last rib and mid-axillary line. So you can start up or down, and tympani, and then dullness. So her spleen is approximately over here. And then you can lift with the left hand to palpate, and then use your right hand. You lift the spleen with your left hand and then use your right hand to try to feel it. According to all of the material that I've been reading and listening to, you're not supposed to be able to palpate a healthy spleen. And I don't feel anything, any enlargements. So again, with the liver, for palpation, you put your hand underneath the patient's back and then lift gently. And then at the area where the lower portion of the liver that you marked, you put your hand straight down and palpate gently in circular motions and feel for any nodules or any irregularities. And again, the literature states that you really are not able to palpate a healthy liver, which I know. Finally, there's some other tests you could do on a patient that would indicate some abnormalities. There's rebound tenderness, and rebound tenderness you would use to assess for appendicitis or any painful things going on in the abdomen. Basically, you just press on the abdomen, and then when you let go, the patient will experience pain. You feel anything there? No. Okay. And then there's the Murphy sign, which when you press by the gallbladder, which is around the same level as the umbilicus, you would get a positive Murphy's if the gallbladder was inflamed. And then just to do some light palpations around the umbilicus area, just to feel for any nodules or bumps. And everything is normal. And that concludes our assessment of the abdomen demonstration.